Good evening. The city at the heart of a public health crisis in China is shutting its public transport network to try to prevent the spread of a virus that's already infected hundreds of people. As millions across the country prepare to travel for the Lunar New Year celebrations, the coronavirus has already claimed the lives of 17 people, but the number is expected to rise sharply. Now, the virus was first detected in the city of Wuhan at the end of last year, and that's where the majority of cases have been reported. A handful have since been detected in other parts of Asia, and last night the first case in the United States was confirmed. The main symptoms of the virus include breathing difficulties, fever and coughing. But in vulnerable people, especially among the elderly, it can lead to organ failure, pneumonia and death. There's no treatment, so prevention is a top priority. Our medical correspondent Fergus Walsh has more details.
This is the epicenter of the outbreak. Hospitals in Wuhan are overwhelmed. More than a dozen health workers have been infected, so medical staff have started wearing full protective suits. Now, in a dramatic attempt to slow the virus spreading, the city's entire public transport system is being shut down. Within hours, all flights will be grounded, all trains and bus stations closed. Residents are being urged to stay put. Wuhan has a population of 11 million people, more than live in Greater London. Wuhan International Airport handles over 24 million passengers a year, with direct flights to London, Paris, Dubai and other cities around the world.
Beijing's authorities have cancelled New Year celebrations this weekend as a precaution as fears about the spread of a deadly new virus grow. Singapore has just confirmed its first case of the virus. Two more Chinese cities, meanwhile, have joined Wuhan, where it was first identified, in being put into lockdown. Huanggang and Ezhou, with a combined population of 8.5 million, are 70 kilometres away from Wuhan, where 11 million residents have been told to stay put. Well, the World Health Organization has said such a massive operation to restrict people moving and spreading the disease is unprecedented. They say it's not something they have advised. Official figures now say 25 people have died, 600 more have been infected, most of them in Wuhan. Stephen McDonnell reports.
Wuhan is in virtual lockdown. In this city of 11 million people, you're not allowed to enter any public space without a mask. All public transport has been closed. The last flights in were already half empty. The final train services were also eerily quiet. Normally the Lunar New Year rush would mean you can't get a ticket.
Here we're at the very epicenter of the virus. Maybe it's best not to travel.
I'm confident that our government has the situation well in hand and that the situation will be quickly brought under control.
Now, wherever you look, people are wearing masks. They're lining up to buy more masks. Some people are cancelling their trips, and there is a lot of concern. And what's really made people pay attention to this health problem has been the shutdown of Wuhan.
The Wuhan shutdown has made this emergency suddenly very real for people right across China, triggering memories of the 2002 SARS outbreak, which led to more than 600 deaths.
We begin with the major new developments in China's coronavirus outbreak. Two major cities are now under lockdown as China races to contain the mysterious illness that has killed at least 17 people. Another city is shutting down all their train stations.
Quarantine orders affect more than 18 million Chinese citizens. The virus has infected nearly 600 people in at least 6 countries, including the U.S., where a second possible case was reported overnight in Los Angeles. Remy Inocencio is in Beijing. He left Wuhan, the epicenter of this outbreak, just before they closed off the city. Remy, what about the one confirmed U.S. victim?
Good morning. That's right. Health officials in Washington state say that man flew here to China, to Wuhan province, visited and then flew back home. Now, airport screenings, those have become stronger since then. Take a look at this video because you can actually see our own CBS News team landing back in Beijing from Wuhan ourselves and then getting temperature checked by officials right off the plane. Such interesting stuff there. But critics, they're now saying that China's move to try to isolate nearly 20 million people may just be too late. Disinfection point.
This was a scene inside Wuhan's international airport yesterday. Just before we boarded our flight, you could see nearly every person wearing a mask in the terminal. But today, it'll look more like a ghost town, along with the main train station. Wuhan's 11 million people are being told they can't leave, a major step in the city's and country's fight against this virus.
We stress to them by having a strong action, not only they will control the outbreak in their country, but they will also minimize the chances of this outbreak spreading internationally.
Coronavirus. Over the past 24 hours, the death toll has nearly doubled to 17. More than 500 cases have been reported. And here, the New South Wales Health Department is investigating one suspected case. Chinese authorities have now shut down all outbound flights and trains from Wuhan as they try to contain the virus.
The government's bombshell in the early hours of the morning presented people with an impossible choice. Stay in the city for who knows how long in the midst of an escalating epidemic, or try to get out quick smart. As you can imagine, many people made a beeline for Wuhan's airport and train station, but others opted to bunker down to be with their families. These passengers are travelling where others would prefer not, desperate to spend time with family on the Lunar New Year. We joined a plane load of travellers into the coronavirus epicentre, Wuhan, a city of 11 million people. But within hours, the situation here had dramatically changed. A government announcement at 2 a.m. abruptly declared anyone who wanted to leave had just 8 hours to get out.
Why should I worry? The virus is already here. I'm not concerned.
I can still leave, but now I've changed my mind. I've decided it's better to stay here with family.
The government ordered all public transport to stop at 10 a.m. The potential for this virus to spread during the holiday period is mammoth. Mainlanders are expected to make 7 million trips abroad this week and hundreds of millions within the country. They now make 150 million more trips out of China each year than when the SARS virus spread in 2003.
Now, the World Health Organization has delayed its decision until tomorrow over whether to declare a global health emergency as China's coronavirus continues to spread. The official death toll from the outbreak has risen to 17. 440 people have been infected. The WHO's Director General says he expects to make a more definitive decision tomorrow.
The decision about whether or not to declare a public health emergency of international concern is one I take extremely seriously, and one I'm only prepared to make with appropriate consideration of all the evidence. Our team is on the ground in China as we speak, working with local experts and officials to investigate the outbreak and get more information.
It started with a few cases of what seemed like pneumonia, but Chinese officials quickly realized it was a new kind of virus, one that could cause infections in animals and humans.
This new coronavirus was initially traced to live animals.
The Chinese confirming that it is now spreading from human to human.
By mid-January, less than a month after it had emerged in Wuhan, China, at least 17 people had died. Hundreds have been infected across Eastern Asia, and one case was confirmed in the US.
Most people are actually stressed because their flights are being cancelled.
But why is the coronavirus, a type of respiratory virus, causing global concern?
A respiratory virus is what infectious disease experts fear the most because you cough, you sneeze, you're in the same airspace, and it can spread very quickly.
Just like the measles outbreak in 2019.
That's why measles is the most contagious disease on Earth, because those droplets can hang in the air for 2 hours, and if you haven't been vaccinated and you walk through in 2 hours, you're 90% chance you will get sick.
It's unclear how easily the new virus spreads, and lack of information only adds to the confusion. There is, however, actual concern that this outbreak will be similar to the SARS epidemic in 2002, where the virus spread from China to more than a dozen countries. That time, over 8,000 people were infected and more than 700 people died. But why are pandemics, like this one, Zika and Ebola, continuing to emerge in the same parts of the world?
Emerging diseases come from specific regions on the planet. We call them the hotspots for emerging disease. Places like Southeast Asia, South Asia, Central West Africa, and Latin America. These are areas with a lot of wildlife, a lot of diversity. When humans come into contact with those wildlife species, we have a chance of picking up the viruses.
Since the SARS epidemic, many countries, including the US, have implemented multiple plans to stop the spread of these type of viruses.
I think health officials think that we are much better prepared now, especially after Ebola. Chinese scientists were able to sequence the genome of this virus very quickly, post it online for people to see, and when that's shared, that information, scientists can work very hard to figure out diagnostics.
Chinese authorities have shut down rail and bus lines, canceled hundreds of flights, and cut off highways from the epicenter of the outbreak. And to protect against infection from this and other viruses, the CDC recommends basic hygiene techniques like constantly washing hands, staying hydrated, and coughing into one's arm or a tissue.